The impact on the hospital has been tremendous. At the beginning of November, we had the lowest inpatient number of COVID patients we've had since the beginning of the pandemic. By Thanksgiving week, that number had doubled. And then today, unfortunately, that number has doubled again, and we've hit an all-time high of patients with COVID in our hospital.
Hospitals are full. ICUs are getting there. ERs are as busy as ever. We want to keep all of our patients outside of the hospital. If we don't have any beds, and more importantly, if we don't have any nurses and doctors to care for them at the hospitals, they're going to suffer.
I have to admit, though, it's been a challenge taking care of our patients as well as taking care of each other. As a nurse myself, I know that we choose this profession because we want to make a difference, and we are trained and ready for crises such as this pandemic.
Our patients who are seriously ill sometimes have a chronic disease like cancer or heart disease, but they also come in with COVID. And it's a really challenging time for them because it's very uncertain how they're going to do. All the healthcare workers are doing our very best to take care of people, and it's really stressful.
Thank you for joining us. I'm Peter Lee, coming to you virtually from Sacramento. I'm the Executive Director of Covered California, and I'm also proud to be one of the 3 co-chairs of the Get Covered 2021 initiative. So, as you saw from the opening messages, no one knows better the impact of the coronavirus surging across America than the doctors, nurses, and others providing care on the front lines. These are people who are indeed healthcare heroes, and they need our help. With recent news on the vaccine for COVID-19, there's now light at the end of the tunnel. Yet it's going to be months before most of us get vaccinated. In the meantime, cases are spiking and hospitals are being pushed to their limits in every part of America. And too many of our friends and neighbors are getting sick and dying from the coronavirus. To speak to these issues and the connection between responding to COVID-19 and getting insurance coverage, you'll hear from many people by video, and with me today are Josh Peck from Washington, D.C., Carrie Banahan from Frankfort, Kentucky, and Dr. Bill Wolf from Columbus, Ohio. We're joining together in a national call to action, urging everyone to stay home, stay safe, wear a mask, and get health insurance. I know we're all tired of wearing these masks, but we've got to pull together for a little bit longer. It's literally a matter of life or death. Together we can beat COVID-19 and get back to a day-to-day reality of hugging our loved ones, eating at restaurants, both outdoors and indoors, and safely joining at crowds in churches, sporting events, shopping at the mall. But the only way to beat COVID is to mask up and in the coming months, get the vaccine and get insured if you're able to. That's why we're here today. On behalf of the Get Covered 2021 Coalition, it's my privilege to welcome you to a preview of Get Covered America Day. Tomorrow, December 10th, is the National Day of Social Media Awareness and Action. We're asking everyone to take to social media and share a message about COVID-19 safety and encourage their friends and family who are uninsured to get covered now. Our goal is to have Americans from all walks of life encourage each other to stay safe, stay home, wear a mask, and let their family and friends know that there is a pathway to affordable insurance now for millions of Americans. We're asking America's help to spread the word to the 16 million uninsured that are eligible for financial help so they get covered with insurance. Now, I'd like to hand it over to Josh Peck, the co-founder of Get America Covered and one of my fellow co-chairs for the Get Covered 2021 Coalition, to introduce you to the broad coalition of health leaders, patient advocates, elected officials, celebrities, athletes, and others joining us in this call to action. Josh?
Peter, thank you. The coronavirus is one of the greatest health challenges of this generation. Right now, with cases spiking across the nation, we're being reminded in very dramatic fashion that while we may be on the verge of a vaccine, the pandemic is not over. In fact, more are ill and dying right now than ever in the pandemic. This is a national call to action. Wear a mask, wash your hands, watch your distance, and unless you're an essential worker or must go outside, please stay home. But even as we face the worst health crisis in more than a century, we have another crisis. We have a crisis in the fact that there are an estimated 28 million Americans who do not have health insurance. Of those, more than half, 16 million Americans, are uninsured even though they're eligible for financial help or free coverage through Medicaid. These millions of Americans live in every state in the nation and are at both health and financial risk, making them vulnerable not only to COVID-19, but also because they lack access to care that can help prevent and treat diseases like cancer, diabetes, heart disease, and depression. Based on the best national estimates, the 16 million Americans that are uninsured but eligible, 525,000 are now or have been infected with COVID-19, nearly 90,000 are living with cancer, and more than 1.7 million are living with diabetes. Unfortunately, Americans in 36 states are not receiving the outreach and encouragement they need to help them sign up for health coverage because of decisions made by the current administration to pull back on marketing and advertising for the Affordable Care Act. While the incoming Biden administration is likely to change course, we want to be sure that right now, the 16 million eligible Americans know that they can help, they can get help and can act on it now. Why? Because 2 out of 3 healthcare.gov customers this year have the option of a plan with a monthly premium of $10 or less. And for millions, they can pay next to nothing through Medicaid. Get Covered 2021 is about dozens of groups, thousands of physicians, and many regular Americans leaning in to get the word out. I would now like to invite a few of our coalition members to share their perspective.
Today in America, too many people in our communities don't have health insurance. It's one reason why Black Americans are disproportionately impacted by COVID and other health conditions. That's got to change. Get Covered 2021 is fighting to ensure everyone can have health insurance, access to care, and equal opportunities. If you have insurance, that is great, but you can still help. Share a personal message of why insurance matters to you so that someone who does not have coverage might see it and act. When they visit getcovered2021.org, they can simply click on their state to get information and enroll.
Hi, my name is Elena Rios with the National Hispanic Medical Association. COVID has impacted everyone, your family, my family, all of us. It has been particularly harsh to Latinos. For me, it underscores how important it is to be both safe and healthy. If you're sick, you can't work, you can't learn, you can't live. Right now, we all need to wear a mask to prevent the spread of COVID-19 and have health coverage to get care.
I'm Harold Wimmer, National President and CEO of the American Lung Association. At the Lung Association, we recognize everyone needs quality and affordable health care, especially patients with lung disease. This year, as we battle a new lung disease, COVID-19, it's more important than ever that all Americans have health insurance they can count on to help manage any pre-existing conditions and provide coverage of treatment if they get sick. COVID-19 is impacting Americans from all walks of life. All of us need to get and stay covered.
The American Lung Association, National Hispanic Medical Association, American Public Health Association are among the dozens of groups who've come together with a message. Together, we're urging people to stay healthy by wearing masks, to help stay safe from the virus, and to get insured, to help everyone who is eligible for financial help for Marketplace coverage or Medicaid to enroll and be covered. We're calling on Americans to take to social media. We're engaging the health organizations to share information with their members. We're working with physicians to help them get personal messages out to their patients. We're reaching out to athletes, actors, and celebrities to tell their personal stories. Our website, getcovered2021.org, is a catalyst, connecting people from anywhere in America to their state health exchange or healthcare.gov so they can easily enroll. The website and its tools are available in English and Spanish because we want to reach as many Americans as we can. We're calling on everyone to be COVID safe and to either get themselves covered with insurance or help someone they know to do the same. Getting covered saves lives. I'm now pleased to introduce you to 3 people who shared their real-life experiences about how being covered has helped them and literally saved lives.
So I am a single mom. And before Cover California came out, I was paying over $1,000 in insurance off of the exchange. When Cover California came out, I was able to save a little over $600 a month, which made a huge difference in my pocket. I think even now it's so much more important to have health insurance just to give us peace of mind.
Well, the Affordable Care Act is important to me because it saved my life. After my employer that provided my health insurance went out of business, I lost my voice and we procrastinated going to the doctor because we didn't have health insurance. And when the ENT looked down my throat, they pretty much came to the conclusion that I had stage 4 cancer. I was in intensive care for 9 days, and the bill that they sent my wife was over $600,000. And my coverage through the Affordable Care Act started on April 1st of 2012, and my chemo and radiation started the same day, and it saved my life.
Y la abuela de mis hijos, mi ex suegra, se comenzó a sentir mal y mi hija la llevó a que se hiciera la prueba de COVID y salió positiva. Nada exagerado. Para amanecer el sábado en la mañana despertó mal. Mandé otra vez a mis hijos a que se hicieran la prueba y mi hijo mayor y yo salimos positivos. Visto en mi vida, su familia, incluyéndome a mí, nos despedimos de ella por medio de un Zoom meeting.
These people are exactly why Get Covered 2021 is so important. None of us want to see friends or family getting sick from the coronavirus. None of us want to say that final goodbye to a loved one by Zoom. And no one wants to be uninsured, but you sure don't want to go without coverage during a pandemic. Right now, we are in the 2021 open enrollment period. For most Americans, open enrollment ends December 15th, next week. In some states, it continues through the end of January. But nationally, as you heard from Josh, 36 states rely on the federal government for marketing, and the current administration has virtually stopped all promotion. In terms of new enrollment, those 36 states are running at close to last year's pace in signing up those previously not enrolled in coverage. That pace, however, reflects the sad result of years of not letting uninsured Americans know that help was available to them. Enrolling the same number of new enrollees in 2021 as last year doesn't mean we're, as a nation, on track to good enrollment. It means that here, in the midst of the worst healthcare and economic crisis of a generation, about 1.8 million fewer uninsured Americans would be getting coverage in marketplaces than enrolled in 2016. The last year, the federal government was all in on promoting coverage. And remember, 2016 was not a pandemic year, was not a year in which millions of Americans had lost coverage because of the COVID recession. That's the wrong track. And that's why we've come together to get the word out now across America that healthcare coverage is available. With 16 million Americans eligible for financial help, yet uninsured, the Get Covered 2021 Coalition is working to get the word out. As we fight COVID-19, we must fight twice as hard to get people insurance coverage. One way we're doing this is that the Get Covered 2021 Coalition is working closely with the nation's leading groups representing physicians, medical groups, clinics, hospitals, urging them to reach out and share this message about COVID-19 safety and coverage directly with their patients. We all listen to our doctors, And across America, thousands of doctors are reaching out right now directly to their patients. Now, at the outset of this event, you heard from some doctors and a nurse on the front lines of providing care in California. In our state, tens of thousands of doctors are sending personal messages to each of their patients saying, wear a mask, learn about insurance coverage options for those they care about. So it's now my pleasure to introduce Dr. Bill Wolf from America's Heartland, Columbus, Ohio, where he's part of the Central Ohio Primary Care Physicians, a group of over 450 frontline docs providing care to almost 500,000 people in Ohio. Dr. Wolf is also the incoming board chair of America's Physician Groups, a leading organization encouraging medical groups and their doctors to talk to their patients about how important it is to stay safe, mask up, stay home, and get insured. Dr. Wolf, thanks for joining us today, and thanks for sharing what you and your colleagues are seeing in Ohio and how you're getting the word out to your patients.
Thank you, Peter. It's a pleasure to be with you and to partner in working to overcome this greatest healthcare challenge that we have faced in our lifetimes. I'm the Chief Executive Officer of Central Ohio Primary Care Physicians, and as you mentioned, we care for, as the largest physician-owned primary care group in the country, we care for over 450,000 patients. As you mentioned, I'm also representing America's Physician Groups. APG represents over 350 physician groups and over 200,000 physicians that care for 45 million Americans. You're correct. Ohio has been devastated by COVID-19, and every one of our physicians and our staff are healthcare heroes, and they're on the front lines. Of late, Ohio's been running about 10,000 new cases a day, and just yesterday reported 25,000 new cases and 657 hospitalizations in 24 hours, both double our current rates. Too many people believe that this is just an illness that affects the elderly, and that's just simply not true. Prior to this call, I reached out to one of the wings in one of the ICU units in town, and in that one wing, they have a 33-year-old, a 35-year-old, a 48-year-old, a 52-year-old, a 54-year-old, and a 57-year-old, all on ventilators with COVID. That's just one wing in one ICU in this city. And that is being repeated across this state and across the nation. We are losing patients every day. Our organization learned a very important message early in this pandemic. Our patients were desperate for consistent and reliable information, and we needed to be that trusted source. Our patients hear from us regularly by email and via our portal regarding our recommendations, and the most important is masking. Patients trust their physician, and it's our role in a pandemic to communicate with them regularly for both their physical and their mental health. In addition, as part of Get Covered 2021, APG is reaching out to all its physician group members, asking them to communicate with patients directly, regularly, telling them to wear a mask and get coverage if they can and when they can. APG is a leading national physician organization, and we take the responsibility for our 45 million patients very, very seriously. Thank you for including us.
Dr. Wolf, thank you so much. And one of the things I want to pause to remind everyone about, when Dr. Wolf talks about calling an ICU, one ICU in one hospital in Columbus, Ohio, we're all hearing about ICU capacity. But what does that really mean? That means a 35-year-old on a ventilator, a 40-year-old, a 50-year-old, a 60-year-old. ICU capacity is Americans lying in ICUs needing critical care. We don't want them in the ICU. We want them safe, which is why we need to be wearing a mask. So Dr. Wolf joined us because he's part of Get Covered 2021. Your efforts and those of your 450 frontline colleagues are saving lives by providing the care you provide, but also you're saving lives by getting the word out about COVID-19 safe practices and letting hundreds of thousands of people in Ohio know there's a pathway for insurance coverage. Many other doctors across America are doing the same thing, reaching out to their patients to get that message across. So now, I'm really happy to introduce Carrie Banahan. She's the third co-chair of Get Covered 2021 and Kentucky Cabinet for Health and Family Services Deputy Secretary. Carrie?
Thank you, Peter. Get Covered 2021 was founded by states that have marketplaces or, like Kentucky, are creating them. In Kentucky, we are reestablishing our state-based marketplace in part so we can do the right thing by directly responding to and reaching out to people throughout our state. Get Covered 2021 includes red states and blue states, but across the board, we agree that we need to take the politics out of our work to both respond to COVID-19 and to getting Americans enrolled in healthcare coverage. At getcovered2021.org, you will learn about the many states who have declared December 10th as Get Covered American Day. States like Massachusetts, Washington, Oregon, Connecticut, Rhode Island, my state of Kentucky, and the District of Columbia, to name a few. In fact, DC has a great jingle to get everyone inspired to enroll. Marketing and outreach are critical elements to encouraging people to sign up for healthcare coverage by letting them know that financial help is available and helping them all understand their options that are available. Many states have leaned in a big way. I'm happy now to share a few words from Kentucky Governor Andy Beshear and Maryland Governor Larry Hogan about efforts in their states.
I'm Governor Andy Beshear. Today is a proud day for our Commonwealth, a chance for Team Kentucky to move one step closer to a truly safe and healthy community. Today, Kentucky joins the strong coalition of states in kicking off Get Covered America Day. The goal of Get Covered America Day is to get all Kentuckians and all Americans insured through some form of health care coverage and to assist those eligible in signing up for free coverage through Medicaid. Coverage matters. It provides treatment for cancer, diabetes, and more. And with the rise of the coronavirus cases across the Commonwealth and our country, there has never been a more important time than now to ensure quality health coverage for all.
I'm Maryland Governor Larry Hogan. The COVID-19 pandemic is impacting Americans from all walks of life and serves as a reminder of the critical need to stay healthy and to make sure you're receiving the best health care possible. Unfortunately, many in our state may not be receiving health care they need due to a lack of health insurance. On this Get Covered America Day, I urge you to go to marylandhealthconnection.gov and enroll in the right health insurance plan for you. It's safe and easy, and many Marylanders may qualify for assistance to dramatically lower their costs. Open enrollment runs through December 15th, so let's do our part. Make sure you get coverage by visiting marylandhealthconnection.gov, or find more information on health insurance plans by visiting getcovered2021.org. Thank you.
We're so grateful for the bipartisan leaders who are helping to drive the Get Covered 2021 message across our nation. As we have been saying, this is not an awareness campaign. This is a call to action. Tomorrow is Get Covered America Day, but we're not done tomorrow. We'll be getting the word out until December 15th, and as we move into 2021, we'll be encouraging people across the country to visit our website, getcovered2021.org, which will connect people from anywhere in America to their state health exchange or healthcare.gov so they can easily find out if they're eligible for financial help. From those sites, consumers can either enroll or get access to a local health insurance agent or navigator to help them get the coverage that's right for them. Our goal is to blanket America in social media posts from physician to patient, friend to friend, and celebrities to millions of followers. And it's already started. We're so fortunate to not only have bipartisan support, but to also have a star-studded group of Get Covered 2021 ambassadors helping amplify our message. You can see some of their posts on the screen now, and you can see more and share those that hit home or other messages on your own social networks at getcovered2021.org. We're seeing influencers and major celebrities like Mark Hamill, Alyssa Milano, Sarah Silverman, coach of the Golden State Warriors, Steve Kerr, Major League Baseball All-Star and commentator Adrian Gonzalez, and more, all sharing this important message. So far, they've reached more than 40 million followers about the importance of getting and staying covered. We'd like to introduce you to a few of our Get Covered 2021 ambassadors and share excerpts from their video testimonials. And as they always say in the movies, make sure you watch to the end.
Hey y'all, it's your old pal Sarah. What's up? You know, we're living in crazy times from COVID-19 to cancer and everything in between. People need to be covered. There needs to be affordable health care. Every American deserves affordable insurance and quality health care. So go to getcovered2021.org and they're going to help you figure it out and get covered.
The COVID-19 pandemic has caused millions of people to lose their jobs and their health insurance coverage. Times are tough, but there is one bit of good news, and that is that most uninsured people are eligible for financial assistance under the Affordable Care Act, the ACA. So visit getcovered2021.org and learn about your options.
But it's not only about COVID. There are 88,000 Americans that are uninsured and living with cancer, and 1.7 million uninsured living with diabetes. This has to stop now. So join me in wearing a mask to stay healthy and getting the word out that affordable health insurance coverage is available right now for millions of Americans.
GetCovered2021.org is fighting for our communities. It's helping people learn how to stay safe from COVID and get financial help or free insurance. I know how important physical and mental health is. Without it, we can't work, our kids can't learn, and our families suffer. This isn't about politics. Health insurance is about equity for everyone.
Covering up with a mask protects not just yourself, but those around you. The same is true for health insurance. In the COVID-19 world, your healthcare could save the lives of others. Enroll in a health plan now through December 15th at getcovered2021.org.
I mean, it's ridiculous. Nobody should die because they can't afford health care. We live in a first world country. So go to getcovered2021.org and get covered. That was like a real sassy PSA ender.
You can see we have a pretty dynamic, diverse, bipartisan group of supporters, all working hand in hand on a critical mission. That mission is one of fostering action. Please do the right thing right now. Wear your mask, stay home, do all you can to keep those you care about safe from COVID-19. When you do this, you're protecting the doctors, nurses, healthcare heroes who are the foundation of America's response to the coronavirus. You're also protecting your family, friends, and all essential workers like those in grocery stores, pharmacies, restaurants, banks. We're going to blanket America with a unified message tomorrow, but we're not stopping there. We're going to continue this effort rolling into the new year because even though much of the nation ends open enrollment on December 15th, many state-based marketplaces like California are open through January, and Medicaid programs across the nation are open every day of the year for enrollment. We're asking all Americans to join Get Covered 2021. Every one of us has friends or family at risk for COVID. Every one of us have friends or family members who are uninsured but eligible for financial help. And all too often, though, we don't know it. You can reach out to them through Facebook, Instagram, Twitter, whatever you use, just reach out to them. Share your story about knowing why COVID safety matters. Share your story about why getting covered with insurance matters. Join the thousands of physicians, nurses, elected officials, celebrities, athletes, others working together to reduce the spread of COVID-19 and reduce the number of uninsured Americans while we're in this pandemic. Look, the vaccine is almost here, which means the finish line is finally in sight. But until we all cross that finish line, we've got to stay COVID safe. It's all of our responsibility. So I want to thank the doctors and nurses, celebrities, athletes who are participating in Get Covered 2021, as well as all the members of this coalition. I also want to thank my fellow co-chairs, Carrie Benahan and Josh Peck, and ask them to join me with Dr. Wolf to take questions from the media participating today. And I'd now like to ask the media to see if they have any questions. Jag Dillon will have instructions on how you can ask questions. Jag?
Thank you, Peter. For our media members, if you have a question, please hit the hand raised icon in the chat and we will call on you. And then please unmute your microphone when called upon.
So while we're waiting for reporters to come on, I'd like to ask a question to Carrie. Carrie, I know you're one of those states that has a deadline of December 15th coming up right around the corner. As you're approaching that deadline, what are you seeing in Kentucky in terms of enrollment and how the COVID pandemic is affecting that?
You know, for the most part, Peter, open enrollment is going well. You know, the clock is ticking down to December 15th, but we want to get the word out to have people enroll in coverage. So here in Kentucky, we have around 175,000 people who qualify for financial assistance either through the marketplace or maybe through Medicaid at no cost, who are completely unaware that they're eligible for coverage. So our connectors are hosting virtual open enrollment events today and tomorrow and are ready and able to enroll individuals in coverage. And through the pandemic, Peter, we've seen a significant increase in our Medicaid enrollment here in Kentucky.
That's great. Thank you so much, Carrie. Jag, I think we have a reporter ready to ask a question. Jag, you want to cue them up?
Yes, it looks like Nay Reynoso has a question. Nay, if you have a question, please unmute your microphone and ask your question. Nay Reynoso.
May, are you out there? That little mute button is often hidden. Not hearing May. Do we have another question? Okay, well, we see if May can figure out her mute button. If I could, Dr. Wolf, you shared some of your frontline experiences about the coronavirus, the story of what's happening in ICUs right in Columbus. Can you talk about the advice that you've been sharing or look forward to sharing with patients, given we were hearing about vaccines coming down the track, and sort of what are you talking to people about in your practice?
So, Peter, just as we have done, reaching out to patients directly regarding all of our suggestions, be it from masking and social distancing and for those over a certain age and with conditions staying home and utilizing telehealth instead of coming to the office. Just in the same way we have reached out to patients in those regards, we are doing the same regarding our recommendation for vaccination. We are paying special attention to our minority population, which has a proven distrust of vaccinations. So we will reach out to patients via email, via our portal, and we will reach out to them individually and directly to encourage vaccination.
Great. Dr. Wolf, thank you so much. So while we see if May can unmute her phone, Josh, I'd like to turn to you for a sec. You mentioned that the current administration has pulled back on marketing and advertising of the Affordable Care Act, and that's had the result of having a lot fewer people sign up. Why does marketing matter? Well, don't people want free stuff?
So over the last year, more Americans have lost health coverage than ever before in American history. And at the same time, there hasn't been an ad on TV in almost 4 years letting people know that healthcare.gov is open for open enrollment or that affordable coverage is available. And, household budgets are really tight for a lot of Americans right now because they've lost jobs or their hours have been cut back. And for a lot of those people, they assume that coverage is too expensive. But we know that this year there are 4.5 million, at least 4.5 million uninsured Americans who have access to a plan with a $0 monthly premium. So there's this huge void where millions of Americans need coverage and aren't aware that affordable options are out there.
Josh, I think that's so true. I will note, Californians may listen to this and say, what do you mean no TV advertising? We actually spend a lot on TV advertising in California. In California, the average Californian hears from us more than 50 times during open enrollment. We spend money on TV, on radio, and social media because it actually lowers healthcare costs. Because more people sign up, and it means premiums go down for everyone because you have healthy people signing up. But I'll tell you, if you have cancer, you're going to find your way to health insurance coverage. you're healthy. You may think, maybe I won't go for it. That's why we lean in on marketing here in California. So I think we have a question from the reporters. Jag?
Yes, Peter. We have a question from Margaret Carrero from KNX in Los Angeles. Margaret, if you could please unmute your microphone to ask your question.
Margaret, go ahead. Don't you love these Zoom realities we've lived in? Margaret from KNX, are you out there? Unmute. Not hearing Margaret. I think we're going to wrap it up. And note, for members of the media, many people are watching us on Facebook Live, on our website. We're ready to do follow-ups with any of the four of us here or other members of this coalition. This work of Get Covered 2021 has thousands and thousands of participants who want to get the word out. So we're ready to talk to any members of the media that reach out to our media line at getcovered2021.org. You can have a media contact there. Any of Carrie Benahan, Dr. Wolf, or Josh Peck or myself would be happy to take your questions. And again, I'd remind you that if you're interested in a Spanish language version of this, we're going to be moving to that immediately following this event. And there's a release on that was released on a Spanish language news release. Thank you all for joining us. To everyone out there, keep wearing your mask, be safe, let your friends and family know that they can get covered now.